The plague is an ancient scourge. It struck fear into the hearts of people centuries ago when it decimated the population of whole regions. Even now, although most people are not aware of it, the plague is still a major public health problem and kills hundreds of people each year. It is an epidemic-prone disease, which can erupt suddenly, even outside its normal endemic area. Thanks to improved hygiene and the availability of antibiotics, the plague is no longer the scourge it used to be. We can treat patients and stop an epidemic in its tracks. But even with the antibiotics available today, people are still dying from the plague. It is not enough to have the right antibiotics. Patients must also be treated as quickly as possible. Treating a case of the plague is a race against time. To reduce delays in diagnosis and save lives, the Pasteur Institute in Madagascar has developed a rapid diagnostic test, which is a great step forward for plague control. This simple test can be used at the patient's bedside, even in dispensaries. However, samples still need to be transported to the National Reference Laboratory for identification of the strains and monitoring of possible antibiotic resistance. To complement the dipstick test, a specific kit has been developed to facilitate the collection of samples and their safe transport. The dipstick test itself is used to detect a plague-specific antigen. The aim of this film is to present these two elements and show how to use them properly. The kit contains all you need to take samples from an animal or person that can later be tested for the presence of the plague bacillus. The kit comprises the following elements: a disposable syringe, a disposable needle, a sterile swab, a sterile Carey-Blair transport medium, an Eppendorf tube with sterile phosphate buffered saline, a calibrated plastic tube for dipstick assay, a chlorine pad for cleaning any work surfaces, an alcohol pad for cleansing the puncture site, an adhesive plaster. The kit is used together with a dipstick test in an aluminum foil bag. For a suspect case of bubonic plague, the following steps show the proper method for collecting bubo pus. Connect the disposable sterile needle and syringe. Aspirate all the PBS. Disinfect the skin with the alcohol pad. Immobilize the bubo. Insert the needle perpendicularly. Inject half the sterile PBS into the bubo and aspirate the pus. Apply the adhesive plaster. Homogenize the sample by transferring it back and forth between the Eppendorf tube and the syringe several times. For a suspect case of pulmonary plague, ask the patient to spit into a plastic container. You need to collect sputum and not saliva. Health workers must take precautions to protect themselves from any risk of aerial transmission and stand behind the patient when he or she spits. Aspirate approximately 0.5 milliliters of sputum. Aspirate all the PBS. Homogenize the sample by transferring it back and forth between the Eppendorf tube and the syringe several times. For surveillance of rat mortality, inject half the PBS into the animal's spleen and re-aspirate the liquid. The steps for a successful dipstick assay are as follows. Gently place about 0.2 milliliters of pus into the calibrated plastic tube up to the black line. Take the dipstick out of the aluminum bag. Insert the dipstick into the tube with the yellow side facing up. When the dipstick is inserted into the pus, the biological material migrates along the dipstick. The pink upper line serves as indicator, confirming that migration has taken place. If the sample is negative, only one pink line will appear. If it is positive, a second line will appear below the first after about 15 to 30 minutes. In order to safely and properly transport the samples to the reference laboratory, the following steps must be observed. Absorb a few drops of the sample with a sterile swab and seal it in the tube containing the Carey-Blair transport medium. Inject the rest of the sample into the Eppendorf tube and seal it tightly. As with any samples that are taken and shipped to a lab, don't forget to complete and include the paperwork. By simply following these different steps, you will ensure reliable results and send good quality clinical samples to the central laboratory. Important reminder: whenever you handle any material, it is important to protect yourself and others. Always use single-use gloves, a mask for pulmonary plague, forceps to handle the dipstick. After use, don't forget to disinfect the forceps. By following these steps, you will save lives and help to control plague.